Good morning, it's Dr. Rapiti. Welcome to another video. It's Saturday the 6th of August 2022, and today I want to talk about a major French study that looked at a link between myocarditis, pericarditis to the vaccines. And this was based on a large database from the French study. It has never been done before, and the authors of this study found that there was something like 1,612 cases of myocarditis and 1,613 cases of pericarditis. Let me explain to you what the difference is. Myocarditis refers to inflammation of the heart muscle. Muscle looks like this, and all the muscle fibers are inflamed. To what extent we don't know, but of course one does something like a troponin T, one will determine the extent of damage. And pericarditis refers to the covering of the heart. There's inflammation. If you have inflammation of that covering, what it can lead to, and it does lead to, is a restriction of the heart from expanding. You know, the heart expands and narrows and expands and collapses to pump out blood. But once you've got a restriction, it cannot, and you can end up with severe heart failure. That's just for the public to understand what we're talking about. They found that the risk was very high with the Moderna first dose, and it got even worse with the second dose. And that, to me, is pretty axiomatic. It's not rocket science. If you react to a drug the first time round, certainly you are going to react to it the second time round, and probably even worse. So I don't know why we seem to be unaware, or pretend to be unaware, that if it's a simple case. If you've had penicillin and you reacted to penicillin once, you wouldn't take a chance of taking a second dose, because there's a risk, a greater risk of you getting an anaphylactic shock and dying. But for some reason, our doctors, specialists included particularly, seem to think otherwise. And I'll tell you in my next case. But in this particular study, they found that males had a higher incidence of myocarditis than females. They found with the second dose, females were equally affected, and that was in the younger adult group. So nobody's really spared from the side effects or severe side effects, toxic side effects of these vaccines. What was found is that the Moderna vaccine seemed to give a result in a higher incidence of myocarditis. And this is thought to be due to the fact that the Moderna vaccine, remember, has about 100 micrograms, whereas the Pfizer has 30 micrograms. So you are having a 3 times higher dose, so it makes sense that a higher dose might lead to a higher side effect rate level. So there we have it, and they said it would respond to therapy. I'm wondering, what therapy are you going to use when you've got a severe myocarditis? Anti-inflammatories, if anything. I know from my medical years of studying that you don't use these non-steroidal anti-inflammatories. They don't really work. If anything, you're at risk, and they suggest that you go for treatment immediately should you experience symptoms like chest pain and heart failure. Well, I'm afraid to say that these symptoms don't present very early in the disease. You are quite unaware of it when you have it. And unfortunately, when you do have it, it's often when you are exerting yourself in harsh physical exercise, like playing a game of soccer or rugby and running on the field in athletics. Because then what happens is, you're putting a diseased heart, unbeknown to yourself, suddenly under a pressure that it cannot handle. With the result, you end up with what we would call a sudden cardiac or sudden adult disorder, unexplained disorder. I don't think we should call it unexplained until we've done biopsy, autopsies, and come out clearly that there is no correlation. I have no doubt. If one looked hard enough into the heart muscle, one would find spike protein. Remember, the spike protein doesn't leave your body. Once it's in your body, it stays. It's supposed to remain in the deltoid muscle. Like I mentioned, this is the deltoid muscle, and stay there and gets destroyed. That is what normal vaccination does, but not in this new gene therapy and toxic technology. 75% gets into your body, and wherever the spike protein lands, it will cause damage via inflammation, and will be carried by the lipid nanoparticle, which is equally toxic. So you've got a double whammy: the spike and furthermore, these spikes are known to enter the blood cells and into the cells of our body, and they actually have the ability to then convert these cells of our own body into gene factories. They're producing these spike proteins, so you're going to have a regular release of these spike, so you're not going to be exonerated from it, and there's really no way of clearing it out. So I think what we're going to be seeing is that the adverse of these events from these vaccines on a prolonged basis, because as we go along we're going to see more side effects. And I want to talk about the next patient that I listened to. It was a 52-year-old male nurse who gave his story to Dr. Mobin Said on YouTube, in which he mentioned when he took the first dose of the Moderna, I think, vaccine, he developed severe neurological signs. He had muscle weakness, tingling in his arms, and absolutely distressing tinnitus. Tinnitus is a ringing sensation in your ears. Could you imagine walking about in your daily life, in your sleep, and you hear this constant loud noise bell ringing sound? Well, this is what this poor nurse practitioner went through. He went to see a neurologist, and he said, well, none of the doctors wanted to commit and say that it is vaccine related. They couldn't explain it. They did all the tests for SLE and God knows what. And this was a perfectly normal person, human being. He was fit and healthy, 52, in good medical condition, physical condition. And they could, and this is what shocked me so much, is that the neurologist said, well, if your symptoms settle on a bit of steroids and you don't feel so bad, go for the second shot. And for this poor man, he took his second shot of the vaccine, and lo and behold, he had a major flare-up of his symptoms, which is to be expected. I would not recommend somebody take a drug that gives you an adverse reaction. And we must remember something. In medicine and in drugs, when we talk in drugs in particular, they take a lot. Some of these drugs take a long time to present with adverse events. I had a young man who came to me saying that he feels terribly ill, and I couldn't figure out what he was saying, because patients do not give you. And he said, and then the penny dropped, and he told me, when I stopped taking my Fedaloc, I felt much better. And my wife insisted I must take it for my blood pressure. When he took it back, he felt lethargic, he felt lame, he felt dizzy, and he felt muscle pains. And this is something that I'm seeing quite often with calcium channel blockers and ACE inhibitors, commonly used drugs for hypertension, rarely mentioned by drug companies, so therefore doctors are quite unaware of it, and they can always be misunderstood for other conditions like arthritis and general malaise. But here's an example. So we're going to see a lot of side effects coming from the vaccines as we progress, because the symptoms are going to be delayed, and the manufacturers are going to lie and say, well, you can't prove it. It doesn't take that long. Oh yes, to the manufacturers, if you're a person, I would say to you, you might even see it 5 years down the line, and you are definitely responsible. You should take some. So now, should we be gloating and being excited about SAPRA finally acknowledging that somebody got a Guillain-Barré syndrome? I don't think so. I don't think so at all. Why are they coming out only now with one? There have been enough evidence. If they fail, SAPRA was terribly remiss in not investigating the numerous reports. If you go to SA-VERS, you'll find the number of cases. In my practice alone, had 2 people with blindness, sudden blindness, which we think was through the vaccine, and I called a spade, and I did not lie to them or tell them use terms like incidental. I don't believe that is the case. I had one patient with trigeminal neuralgia, which is pain in the arm, one with Bell's palsy, which is paralysis of the face. I've had one person who ended up with a sudden cancer of the lung, perfectly normal person after the vaccine, and another gentleman with a stroke, and one actually died of kidney failure. So there is, if we collect all the GP's evidence, we'll find that there is enough to fill our books to show you that this vaccine is not safe. I mean, what about thrombocytopenia from the J&J vaccine, What about the 85% abortions in the first trimester of pregnancy? What about the 1,293 side effects after the Pfizer documents were released in March? Why were they quiet about it? So I don't take seriously what SAPRA says, and the fact that mainstream media is now publishing this. What are they trying to find credibility? They've lost it all, and I think they need to come clean and say that the vaccines are useless, they are toxic, and they're dangerous. We don't need them. We're out of an emergency now, and the spike protein is not going to be around, and I think it will be terribly remiss if we continue using boosters and propagating these vaccines. In any event, we're out of the emergency now. We're not in a crisis. Hospitalization has fallen, and so has the incidence and deaths. So I don't see why we need an Emergency Amendments Act to be incorporated into our Health Act. Well, that's it from me, Dr. Rapiti. Have a good weekend. Thank you.